Welcome. I'm Donald Norcross. As we continue to battle the corona pandemic, it's more important than ever that we recommit to ensuring that every American has access to affordable, quality health care, including many who are in need of a transplant, specifically a kidney transplant. 37 million Americans have chronic kidney disease, CKD as they call it. The National Kidney Foundation reported over 24,000 New Jerseyans received a kidney transplant in 2019, including almost 7,000 successful living donor kidney transplants. However, 95,000 are still waiting for a kidney transplant. That's way too many. Today, I'm joined with two folks right here from South Jersey who have personal experiences with kidney transplant. Jason Nothdurft donated a kidney in 2014 and is an award-winning advocate for the National Kidney Foundation. Heather Simmons, a Gloucester County freeholder, received her kidney transplant just in 2019. I want to thank both of you for coming in today and having this very real and frank discussion on the need for transplants and what each and every one of you can do. So Jason, let's start with you. First of all, congratulations. You received the highest honor from the National Kidney Foundation. That speaks volumes about what this means to you and more importantly, what it means to all those who are waiting for a transplant. Understanding that you're a donor, talk about that process. How it is that you came to donate one of your kidneys.
So I had seen on Facebook that someone in our community needed a kidney, and it turned out to be the stepfather of one of my closest friends. And I immediately reached out knowing that I grew up with this family through elementary school and high school and sports. And I knew that they needed this father figure in their life. And I also knew that dialysis, while I wasn't an expert on the topic, dialysis was no way to live your life going multiple days a week, multiple hours a day. It would just ruin his lifestyle. I wanted to be a part of the solution to help him live a normal, healthy life. So I volunteered to get tested to donate. We started at a facility outside of New Jersey through the testing process, and we ultimately ended up at Lady Lourdes in Camden, which is of course now Virtua. And it was a great, fast, and wonderful experience. And not long after that, our surgery happened, and the rest is history.
That's remarkable. Thank you for doing that. On the other end of the stick, so to speak, Heather, you recently got a transplant. Walk us through that. I mean, for years you've been battling with the disease and finally you had this opportunity.
Thank you, Congressman. I was diagnosed with diabetic kidney failure at the age of 27 in stage 3. So I suffered from some stage of kidney failure for 24 years before receiving a donation of a kidney from my brother in December of 2019. It wasn't until June of 2019 that I was activated on the transplant list. I had been on a transplant list with St. Barnabas Medical Center in northern New Jersey for 3.5 years and was activated in June because things went awry at that time. And my siblings both stepped forward to be tested as prospective donors. Both of them were found to be a match, and in the end, they chose my brother to be my donor. And I think I mentioned to you and to Jason that it was a gift that in every possible way has brought me back to life.
Wow. And to your brother, thank him for what, as you mentioned, Jason, this is an easy decision, but we know it's an incredibly serious decision that you make. Jason, so there's several pieces of legislation on the federal level. One is called the Living Donor Protection Act, and the second one is the Comprehensive Drug Coverage for Kidney Transplant Patient Act. Why are those important? If you can just give us a little briefing, and what are we doing to try to move this forward?
Sure. First, on the topic of the Living Donor Protection Act, first I have to say that I clearly remember going to your last town hall in the city of Woodbury and being the second person to stand up and ask you to support this. And I'm proud that you support the Living Donor Protection Act. What it does is it prevents living organ donors from being discriminated against by the insurance industry. If you're going for health insurance, long-term care insurance, life insurance, disability insurance, it prevents those companies from charging living donors a higher premium or denying them policies altogether. The reason why it's important to protect the living organ donors is because there's a big misconception that they are less healthy after their donation. While there is a very minuscule chance of something going wrong during the surgery and post-surgery, statistically speaking, living organ donors are the healthiest people and are expected to live longer than the average population.
So I guess that means they watch their health much more than some of the average folks who aren't as attuned to it. And that's why pre-existing conditions and the health insurance is just so important. This is just another example. So Heather, given the pandemic, in this incredibly complicated world of sheltering in place and how we go out, those recipients like yourself who already face some challenges with rejection and your immune system, how has COVID in general changed how you work your daily life? And in general, what impact does it have on recipients across the board, quite frankly?
Well, as a kidney recipient, a kidney transplant recipient, I am among a large group of Americans and people around the world who are considered compromised. Because of the immunosuppressant drugs that I take, it is unsafe for me to have prolonged access to individuals who may have been exposed to the coronavirus. And so, in large part, I work from home, and I am not permitted at this point to go to supermarkets or restaurants or things like that. In my public service, it's also a very big challenge because, as you well know, the nature of public service is being in the public. And so it represents a challenge for me, but it also represents an opportunity because there are so many folks like myself who are compromised for a variety of reasons. And this has provided me with an opportunity to have a lot of empathy for them and to be able to be in a position to help them in a way that perhaps I could not have before.
Incredibly complicated, but you have so many friends, family that to watch you go through this, it expands the universe of those who understand it, those donor cards that come with your driver's license. But it's certainly, we understand that you now are this new person, a new outlook on life. You've always had a great attitude, but since your transplant, you just are radiating a beautiful smile, and that's just so great to see. So Jason, you're one of the great advocates for the National Kidney Foundation. There are a couple items that they talk about all the time. One is called the Big Ask and the Big Give. Would you explain to us what exactly that is and how people can help?
Sure. The Big Ask, the Big Give program is a program that was launched roughly around 2016, 2017. And it does two basic but really important things. One, it teaches people how to ask for a kidney if they need one. And two, it teaches people how to consider giving a kidney. One of the top reasons kidney patients go without a living donor is because they don't know how to ask for a kidney. It's very intimidating to ask your spouse or your child or an extended family member to go under surgery and to alter their lifestyle, to make that sacrifice to benefit them. This program and the National Kidney Foundation, we have websites with videos, we have printed out pamphlets, we have hotlines that people can call into, peer networks, and we just want to make the process of asking for a kidney and giving a kidney much more easier for people to decide to do.
Yeah, a big decision, and how selfless for you to do something like that. Heather, Jason, you probably know this. When it comes to donations, trying to get the right match, I guess, are your siblings automatically the first one because they're an easier match? Is a twin the best? Is a brother, sister? How exactly does the living donor get chosen?
Well, the first step, and Jason can attest to this, is a blood match. So are your blood types compatible? And of course, if the blood match occurs within someone who is related to you, like a sibling or a parent, then they tend to be more likely to be a match across the board, and they tend to be a more successful transplant. In my case, my brother and I actually have the same blood type, and we were as close a match as we could have been without being twins.
Wow, it is incredible. So, living donors versus those who have passed away. Talk to us just sort of the difference. Is there a better success rate from living donors? How does that work? I mean, we all know that you slash out the spot on your license that says, "I like to be a donor," but that's at the end of our life. One versus the other.
First, I want to say that dialysis is an important treatment for people to have available to them. But obviously, transplantation is the better option. The middle option would be from a deceased donor. And on that topic, just on the name deceased donor, speaking to families who have lost someone who have gone on to donate, they don't like their family member referred to as a cadaver, or some other term. Deceased donor is the acceptable description of these people. But they'll understand if not everyone's educated on that topic. But getting a kidney from a deceased donor doesn't last as long as a living donor kidney, and it will still have the same effect as a living kidney donor because of how quickly organs are procured in this country and how they are distributed to patients in need. But the deceased donor's kidney does not last nearly as long as a living donor kidney.
It's a gift of life. And having had a dear friend of mine receive 2 livers over his lifetime, and those who donated, he did not know who donated the first one, but the second one, just that relationship that somebody could continue their life at a time when somebody unfortunately lost theirs was something that the donor's family felt very strongly about, and we certainly can understand that, and we need more of it. How many people out of 100%, how many people have their driver's license a donor checked off? Do we have half? Do we have a quarter? Do you know that statistic?
I personally do not know that statistic. I do know.
Other than not enough, we know that.
Yeah, not enough. In fact, there has been a movement in the state legislature over the years. It's not a really strong movement, but there's been legislation introduced to turn New Jersey into an opt-out state. So currently in New Jersey and many other states, you have to physically check off that box to say you want to be an organ donor when you pass away. What this legislation would like to do is make it so when you get your driver's license or state ID, you're automatically registered as an organ donor. And if you choose you do not want to be an organ donor, you'd have to physically fill out the paperwork to remove your name from that list. That's probably something that I would like to turn my focus to once we get the Living Donor Protection Act and the anti-rejection Medicare coverage bills finished up.
Because one of the things, if they overturn the Affordable Care Act, the idea of a pre-existing condition means something completely different. And that's, in addition to all the other issues we'll face there, that's an additional burden we have to take under consideration. Heather, Jason, anything else you want to mention here?
Congressman, I just want to thank you for your commitment to making sure that coverage is in place for people who are considering donating a kidney. And then on the reverse side, for folks like me, making sure that coverage is in place to make sure that we continue to have the life-saving drugs that will prevent us from drifting back toward dialysis and another transplant in our future.
This is what's great about our country. And when we talk about all the division that's taking place today, here's something that we can rally around and have great outcomes. So to each of you, really do appreciate it. Living proof that it does work.
Yeah, I'd like to say thank you, Congressman, for having us in this conversation with you. I know with my work through the National Kidney Foundation, you and your staff have been incredible on this topic, been very responsive to my requests or our requests and our needs. And I look forward to having that continue into the future.
It is so important for us to show our gratitude to people like Jason and my brother Tim, who have put their lives aside temporarily in order to make this life-giving donation. And the only way that I can see to show my gratitude to Jason, to Tim, and to so many others like them is to pay it forward, to live my life in such a way that it serves the public and find ways to help people like me who are suffering from this disease who didn't have the access that I have. And so that's what I intend to do.
How inspirational, particularly in this time of a pandemic, to hear some good news stories. While we're working hard, that every American has access to good quality health care. We must continue to offer and expand that access to health care and certainly nutritional services. If you'd like to learn more about today's conversation, visit kidney.org/transplantation/living donors. Our office is open. Our team is here to help. Please reach out to my office at 856-427-7000, or you can always reach us on norcross.house.gov. We want to thank you for being here today, and to Jason, to Heather for your stories and what you've done. We thank you and we appreciate you being here.
Thank you, Congressman and Freeholder.
Thank you, Congressman.